Can be complicated. Adriana Alejandre is a trauma psychotherapist. She's here now to talk about mental health in the Latino community. Thank you so much for joining us this afternoon.
Thank you for having me.
First off, starting the conversation isn't easy, especially in the Latino community. Some topics are just off limit in Latino families. We're talking about divorce, unemployment, and in this case, mental health and mental illness. Why do you think that's the case?
I think that's the case because there's a lot of stigmas in our community. One of the big one is connected to religion and how we are expected to heal with only religion. But another aspect within our culture is this emphasis on or normalization on the machismo culture and how rooted that is in many of the decision making within families. Other systemic ones include lack of resources available in Spanish for the Latino community and lack of therapists that are, culturally informed for the Spanish-speaking population, just in general for the community. And then within households, again, we haven't normalized talking about emotions. It's something that is still very taboo. The vulnerability is not seen as a strength. It's seen as a sign of weakness when that is not the case.
Adriana, you just talked about the lack of therapists, Spanish-speaking therapists out there. So how do you go about finding a therapist and one that is able to address your problems and concerns?
That's such a great question. And I think in the recent years, especially with the social media boom, there has been a lot more directories and emphasis on therapists that are culturally oriented. And so one way is to, if you have insurance, to contact your insurance and ask them to filter your search by not only your zip code, but also by their background. So if you're looking for a Latino therapist, then ask them to filter by Latino therapist or Spanish-speaking therapist, and then do your research from there. Another option is to check out our directory, LatinxTherapy.com, where you can also filter by the state that you live in and by your insurance or other options, like are you seeking therapy for children, for families, for couples, etc. There are many different options, and there's other directories as well, but it's really important to conduct a free consultation with the provider and ask them about your experiences. Ask them if they have helped others who have struggled with things that you are seeking therapy for.
And Adriana, you just mentioned one of those resources. It's LatinxTherapy.com, right? We just want to say that one more time, right?
That's right, LatinxTherapy.com.
Gotcha. Now, we know change is slow, and what are some of the solutions to addressing mental health in the Latino population as it grows right here in the U.S.?
Yeah, I think we need to support more organizations that are already in the, front works, already doing some of that work and has reached to the community. And some of these organizations may not be big, they may be smaller initiatives, but I think more funding needs to be provided to some of these organizations, or at least to amplify those organizations' voices. And I think seeking individual, therapy services ourselves so that we can break that stigma within our household, within our community, and talking about it depending on how much we feel safe discussing, right? And if not individual therapy, then support groups. So groups of different emphasis. Another option, if you are not ready for therapy, is to talk to somebody. But I think we definitely need to support overall mental health, normalize it, and start talking and educating ourselves on some of the risk factors.
Step by step. All right, Adriana Alejandre, thank you so much for joining us today. Some really great information that we've shared with our viewers. Thanks again.
Thank you.
Opening that conversation, so important to help our loved ones.